WISHIN is an excellent tool for us to ensure that we're getting accurate information, because oftentimes we're reaching out to the patient and they're not medical experts. They're giving us their best guess on what the doctor has told them, or even if we're reaching out to the providers themselves, it's often not the provider that saw the patient, so they're just reviewing medical records and then transferring that information to us over the phone. A mistake could be made or information could have been missed. So by using WISHIN, we're able to see the full record of that patient's information and make sure we have everything clear. Before preparing for today, I went to my staff and talked to them about what's their favorite things about WISHIN. How was it like in comparison to now? They very clearly said they can't remember not using WISHIN, and if they had to go back to that it would just be very frustrating, and that they feel like they probably wouldn't be able to do as accurate of follow-up as they currently are. So WISHIN is incredibly helpful in communicable disease investigation and follow-up, so we're able to get the information that we need to stop the spread of one being COVID-19, but other communicable diseases that public health follows up on, especially during COVID, would not have been able to get as much done as we did without WISHIN. It was incredibly helpful in helping us find demographic information and reach out to our positive cases. When the lab results were coming in really quickly, they were not coming in with current address, current phone number, and we set up our contact tracers with the ability to use WISHIN to only see that demographic information, and then we could reach out to people and make sure they have the information and support they need for isolation. It was an excellent tool for us, and now that COVID is kind of slowing down a little bit, our nurses are using it for communicable disease follow-up. We're using it with our tuberculosis patients, our Hep B, Hep C patients, to ensure that we have the information that we need, that we don't have to be calling the doctors and interrupting them unnecessarily to get information. We can just look it up in the patient's records, get the information we need, and provide support as timely as possible. It really does make sense. It's the same kind of function that you have when you Google something. You search a person's name, it pulls it up, and it's just natural on the next steps on what to do, and navigating the system just makes sense.